Now to matters closer to home. Something has gone terribly wrong when a prosperous first world nation blessed with an abundance of natural resources has energy costs so high that people are too frightened to cool their homes in the hottest months or heat them in the coldest. The climate catastrophists who shriek the loudest about global warming being an urgent crisis that threatens lives are rather blasé about a deadly crisis they've helped create. They claim people are dying due to global warming when the truth is that the cold weather kills in greater numbers than any warming. And tragically, soaring energy costs will undoubtedly see more vulnerable people die, with increasing numbers of Australians not adequately heating their homes in the coldest months. It should be a source of national shame that so many pensioners, low-income earners and even some middle-income households are opting to remain cold rather than risk bill shock by turning on the heater. There are people who are, or should be, enjoying their golden years, staying in bed until early afternoon, not because they fancy a sleep in, but because it is the warmest place in the house and it means they can delay turning on the heating. 3 years ago, I wrote about research conducted by doctors at the Alfred and academics from Monash University showing people who had been indoors presenting to hospitals with hypothermic emergency. The 2019 paper published in the Internal Medicine Journal revealed that in just 2 inner city emergency departments, more than 200 patients presented with hypothermia, with 23 people dying over a 7-year period to 2016. About 80% of the patients presenting with hypothermic emergency were found indoors, and close to 3/4 of all patients were pensioners. If that is not appalling enough, consider that those stats reflect what happened in just 2 emergency departments and only up to 2016. As we know all too well, energy costs have increased significantly since then and are about to skyrocket further, due largely to self-inflicted harm caused by policies to reduce emissions. Interestingly, the author of the 2019 study is now the member for Higgins, Dr. Michelle Ananda-Raja. This is what she said back in 2019. She said, "We're seeing patients who are clearly coming in profoundly hypothermic and being found indoors. Hypothermia is generally not something that happens suddenly. When you get to a certain temperature, you're vulnerable to sudden death." But during the election campaign, there was not much said about hypothermic patients, but plenty about slashing emissions further and more meaningful action on climate change. Never mind that such action, as we have seen in Europe and North America, invariably leads to greater unreliability and significantly higher costs. We're in this mess because successive state and federal governments have embraced climate change policies that have sunk billions into renewable sources of energy and neglected gas, coal and nuclear. Not just neglected, but in some cases demonised and banned these reliable sources of cheap energy. Sadly, the numbers of Australians whose health will deteriorate due to prolonged exposure to cold temperatures is set to increase in line with soaring energy costs.